Joining us now is Chief Medical Advisor to President Biden, Dr. Anthony Fauci, Director, of course, of the National Institutes of Allergy and Infectious Diseases. Thank you very much for being with us. It's great to see you again, Dr. Fauci.
Thank you. Good to be with you.
So we've just passed this horrible, horrible landmark of 1 million people who have died, lost their lives. We had hoped the pandemic would be over. Now, more and more people are becoming infected with this subvariant of Omicron. It's more contagious than even the previous subvariant. Do we have an accurate picture of how big this case rise is, given that a lot of people aren't testing anymore and home tests really don't go reported very often?
Well, you're quite correct. We are going into an increase. We've now, as you mentioned correctly, for a couple of days in a row, have been over 100,000 cases, certainly not as high as it was at the very peak that we had several months ago. But we've really got to be very careful. And, you know, one of the things that we keep emphasizing, as you know, we've now reached a terrible landmark in this outbreak of 1 million deaths, which is so tragic. And many of those could have been avoided if we had had people who have gotten vaccinated who did not get vaccinated. So one of the things we've got to remember, as we see the cases increase now in different regions of the country, and we believe it will continue that way. Hopefully it will reach a peak and turn around. But the best way to blunt that, Andrea, is to continue to get people vaccinated who are not vaccinated. And because of the waning immunity, namely over time, the protection diminishes over time, to make sure that people who have been vaccinated with the initial vaccine regimen get their booster shot when it becomes due for them. That's really very important, because the difference in severity of disease and the need for hospitalization between unvaccinated people and people who are vaccinated, and particularly those who are vaccinated and boosted, is a major, major difference. So we can avoid morbidity, we can avoid severe disease, and we certainly can avoid many more deaths by getting people vaccinated.
And when you talk about the increase in the numbers of cases, you're seeing that we're seeing, at least in a New York study I saw, that something like 3/4 of the cases were of this new subvariant, which is much more contagious. Is that correct? Is that happening across the country?
Yeah, I mean, each of the new subvariants of Omicron, you remember, Andrea, when Omicron essentially bumped Delta off the table, as it were, if you want to use that terminology, because the original Omicron, the BA.1, was more transmissible than Delta. And then when you have variants, which was BA.2, which was one that was even more transmissible than BA.1, and now we're having one that has a longer name, which is BA.2.12.1, that's becoming more dominant. That's now about 42% of the cases in the country, and we still have about 56% are the original BA.2. Both of those are more transmissible than the original variants, and that's the reason why we're seeing a combination of things and a conflation of immunity against both infection that you recovered from, as well as immunity that were induced by vaccines, wanes over time. And when you get a more transmissible virus like what we're experiencing now in different parts of the country, that's the reason you're going to see increases in cases. And as you know, we've pulled back on many of the issues that would prevent infection. For example, many people are no longer wearing masks in indoor settings, particularly when you have crowded indoor settings. That leads to an increased risk of infection. So all of those things coming together are explaining why we're seeing this uptick in infections over the last several weeks.
Now, let's talk about the COVID funding. It's already been cut in half, really, the $10 billion. It's stuck in the Senate. The foreign piece of it was completely cut out, much to the distress of a lot of people in the foreign aid community, USAID. So if this is not approved, what do you say to the people in the Hill who say, well, there's COVID money already in the pipeline, the states just aren't spending it?
No, that's not the case, Andrea. We really
it's
do
different
need
money, right? Right.
Yeah, it is. We really do need the money that was requested, because if I mean, we're entering right now into a situation where we will be approaching the summer and then ultimately the fall. We need money for vaccines, for boosters, for testing to get the most appropriate boost, to get more antivirals that we already have, as well as antivirals that we need to develop that are better than the ones that we have. We can't do that if we don't get more resources. So it really is unfortunate that these are not becoming forthcoming for us, because we really do need them. True, we've been given a lot of money, but the money has been well spent. I mean, I've been asked the question, well, you've been given a lot of money and we're still having a lot of infections and a lot of deaths. Well, there would have been a lot more infections and deaths if we didn't have it. So we really do need to continue the stream of resources if we're going to meet the challenges which are unquestionably ahead of us.
Talk to me about what is the progress for children under the age of 5? All my colleagues here are asking me about their toddlers. Give us some hope.
Yeah. Well, I'll try, Andrea. The fact is, one of the things we have to make clear to people that the FDA is not delaying the approval of vaccines for children under 5 years old. The FDA needs to get from the companies all of the data together with the application for the emergency use authorization. And when they do, and they have the opportunity, which they are doing it as expeditiously as possible, to evaluate that data, they will come out with a determination as to the safety and efficacy for an EUA. So sometimes there's this misinterpretation that the FDA somehow or other is delaying the decision about that. They're not. When they get the data that they need and they evaluate it appropriately, there will be a decision, and you can be sure that that will be based on the best science and the evaluation of the safety and the efficacy of these vaccines for children 5 years of age and younger.
And let me ask you about long COVID, because many Americans are living with these symptoms for a long time and there don't seem to be any treatments for it. Does the NIH have any plans to start clinical trials, perhaps, for treatment of this condition?
Oh, absolutely. In fact, we're putting together large cohorts of people. First of all, I want to make the audience realize it is a real problem. There's variable percentages, and it really ranges from anywhere from 5 to up to 20 to 30% of people who, after they get over the acute phase, have the lingering of signs and symptoms that for some people can be incapacitating. Extreme fatigue, particularly upon moderate exercise, sleep disturbances, inability to concentrate and focus. So it is real. We take it very seriously, and we're putting together a number of cohorts to try and determine what the underlying cause is, what the pathogenic mechanisms are, and is there any intervention that we can do to either slow it down or prevent it, or in fact, when people do get long COVID, what we can do to treat it. It's a very high priority for us, Andrea.
Well, thank you for all of that. The great medical advice from Dr. Anthony Fauci. Thank you, sir.